Hello there, Dr. Manko here from Ottawa, Canada. A very common question and concern I get is people complain about some chronic neck and upper shoulder pain. Again, just typically from a lot of the high technology, sitting at a desk, getting on an iPad. Even kids are doing the same. So we tend to see the development of what we call the anterior head syndrome or forward posture. It doesn't look very good and it doesn't feel very good, but it can lead to a degenerative process if we don't get a hold of it. So I'm going to give you some simple two things to do here to help yourself, and especially if you can't get to see a health professional, these are some self-help tips at home that you could do. It's two parts. One of them, again, is because when the head tends to go forward like that, the body goes, hey, we can't let your head continue to go forward. So the muscles increase their tension. They pull hard. And that pulling, it gets very tight. You reduce the blood supply through it. It gets to be very sore and very fatigued. So one of the ways you want to do first of all is we're going to lengthen the tissue. And then the other part I'll show you is how to strengthen it so that when you go to work, and hopefully you're set up a little bit more ergonomically, is that the tissues have a higher adaptability because they have a bit more tone. So we're going to stretch first. We're going to show you one strengthen. Two things, very effective. Try it and let me know. Here's how it goes. So I'm going to turn so you can see, put my right hand in my left hand, and I'm going to stretch the right side of my neck and shoulders. So for me to do that, we're going to pull down the right, and I'm going to turn my head to the left, and I'm going to look down. Just like that. 15, 20-second hold. Okay? Come back. Again, we're looking to see if we can do 5 to 8 times. Turning the head, looking down, pulling down. Just like that. So to get the other side, the left side, to release that tension. So then we're going to pull down on the left arm and turn my head the opposite way and look down. Okay, 15, 20-second hold. You can move your head up and down to feel where it's the most tension and hold that spot until it releases. But the idea here, the key thing is that if you don't pull the arm down, you can't open up that side. Okay, so pulling down, turn opposite, look down. You can move your head around to find the tightest spot and hold 15, 20 seconds. So that's how we release the tension part of the upper back and shoulders. Right, so now part 2 is, after we've stretched it and brought some blood supply to the area, is to get some tone or strength in the upper back shoulder area. The way I like to do it, and we're not going to have you putting weights on your head, you're going to use gravity, okay? But we're going to get you to lie down to do it. So follow me, here we go. So we lie down to the floor. I put my forehead on my hands, okay? And then I'm just going to lift up my upper back and neck and look straight ahead and hold that for at least 10 seconds, okay? Once you're done, you bring it back slowly and then back up again. Look up, hold 10 seconds, bring it back down. Now we're not doing this. We're not pushing with the hands. I need you to try to isolate just using the neck and upper shoulder muscles to bring the head over the shoulders. And you do have to hold this for a count of 10. So we're not doing this motion. We're holding and breathing and hold just like that. So the deep back muscles of the neck and shoulders, breathing, 10-second hold. And we're looking again to doing 8 to 10 or 12 repetitions, maybe a couple sets of those. Because again, typically with aging, people tend to lose some strength in that upper back and throughout the whole body. So doing some postural toning will help you adapt better to the demand of sitting. So, because either way, sitting is not great in the long term. People try the sitting, standing desk per se setup. The main benefit there is to get you guys to move. So this is a great way to maybe throw into your work environment if you can do that part, or maybe just do the first part and the second part at home. But it works phenomenally well. Do it maybe 3-4 times a week into your routine. I know you'll find it effective for yourself, but again, give me some comments down below. Make sure you subscribe to these videos because we're doing much more of them into the future just to keep you guys healthier at home when you can't get your healthcare practitioners. So take care, guys, and have a great day, and we'll see you soon.